Welcome to the Vietnam Veterans of America presentation on veterans, spouse, and survivor benefits. The genesis of this presentation was the realization by VVA service officers they were doing a great job of getting veterans the benefits they had earned, but they were not doing such a great job in informing veterans' spouses and families of the benefits available to them. So the VSOs got together to create a briefing which they have been presenting quarterly for several years. The purpose of this presentation is to inform veterans and their families of the benefits available to them. If you have any suggestions as to how to improve this presentation, please notify us. The PACT Act, which was enacted March 5, 2024, addresses exposure to toxic substances during military service. Veterans who served in Vietnam or in Southwest Asia, including Iraq, Afghanistan, Saudi Arabia, or surrounding areas, may be eligible for benefits under this act. The list of qualifying locations has expanded over time and now includes places such as Laos and Thailand. The VA website keeps an updated list of these regions along with presumptive illnesses connected to toxic exposure. Because the list changes frequently, it's important to stay in contact with a service officer and to regularly check va.gov. All veterans are eligible for burial at a national cemetery subject to space availability. Some national cemeteries, particularly Arlington, are running out of space, so they have restricted eligibility to be buried there. Check with the VA and/or a service officer to find a national cemetery in your area. Locally, we have a columbarium at Crown Hill in Indianapolis and national cemeteries in Marion and Evansville. Burial benefits include a burial flag, a grave marker or medallion, and military honors. Military honors are subject to availability. The VA only guarantees at least one service representative and a quality recording of taps. There are some volunteer groups, however, that will provide military honors on request. Veterans' families should work through their funeral director or service officer to contact them. Families can also apply for a presidential memorial certificate, which may mean a lot to future generations. One of the most important things to remember is know where your veteran's DD 214 is. This discharge document is required for almost every benefits, so it's best to have it ready before you need it. Dependency and indemnity compensation, or DIC, is a tax-free monthly benefit for surviving spouses. The benefit applies if the veteran died in the line of duty, from a service-related injury or disease, or after being married for at least 10 years while related 100% disabled by the VA. To qualify, the cause of death on the death certificate must show a service-connected disability or a presumptive condition. It can also be listed as a secondary cause. The current DIC is $1,653.07 per month, and it is tax-free. The benefit changes every December 1st. Another important benefit is the survivor's pension, sometimes called the widow's pension. The pension is designed to prevent the surviving spouse from falling into poverty. The maximum annual pension rate is $14,893. The maximum allowable net worth to qualify for the benefit is $159,240. The spouse's income is included in this calculation, but the home they live in and the main vehicle do not count. The veteran does not need to have served in combat, but they must have served during a time of war for the spouse to qualify. Accrued benefits apply if a veteran had a claim or appeal pending at the time of death. If that claim is later approved, any retroactive award will be paid to the spouse or to the estate of the spouse if there is no surviving spouse. Surviving spouses are also eligible for VA home loan benefits. These benefits transfer to the widow and remain available to them even if they move to another home. Health benefits such as CHAMPVA are also available, and we'll cover that later in more detail. Other state benefits may also be available to the surviving spouse. Let's look at state benefits here in Indiana. Property tax relief can significantly reduce a veteran's real estate tax bill. There are also county-level burial benefits which may vary depending on where you live. Check with your service officer for details. Under remission of fees, children of disabled wartime veterans are eligible for free tuition at Indiana state colleges. Disabled veteran license plates allow free parking at meters across the state, and reduced cost passes are available at state parks. Indiana also has a military family relief fund, which can provide financial assistance to veterans and their families during hard times. Check with your service officer for eligibility and application information. Veterans who live outside of Indiana should check with their state's Department of Veterans Affairs for benefits in their state.
Today I'm going to talk a little bit about what's called CHAMPVA, the Civilian Health and Medical Program of the Department of Veterans Affairs. Note the word civilian. Those eligible for VA health care are not eligible for CHAMPVA, but CHAMPVA claims are processed through the VA. CHAMPVA is a healthcare program which shares the cost of certain medically necessary procedures and supplies with eligible beneficiaries. CHAMPVA only covers care that is medically necessary and appropriate. The VA's mission statement is to fulfill President Lincoln's promise to care for those who have served our nation's military and also for their families, caregivers, and survivors. Notice families, caregivers, and survivors there. There used to be a program called Champus, but this is not Champus. It's more several times since the early days. The Veterans Health Administration, otherwise known as VHA, processes CHAMPVA applications, evaluates claims eligibility, and authorizes benefits. So this is a VA benefit. The veteran themselves is usually not eligible for CHAMP VA because they have benefits through regular VA or other government programs. This is for spouse and survivor, and sometimes children of 100% disabled veterans to be eligible for CHAMP VA. And there are a few other eligibility requirements. Those eligible for CHAMP VA are not eligible for Department of Defense TRICARE benefits and vice versa. CHAMP VA is a VA program, and TRICARE is a regionally managed health program. If a veteran was killed in action, the survivor will always be eligible for TRICARE and not CHAMP VA. Other veterans must be in one of the following categories: spouse or child of a veteran who has been rated permanently and totally disabled for service-connected disability by a regional office, the surviving spouse or child of a veteran who died from a VA-rated service-connected disability, the surviving spouse or child of a veteran who was rated permanently totally disabled from a service-connected disability at the time of death, the surviving spouse of a child or child of a military member who died in the line of duty not due to misconduct, and the primary caregiver for a veteran if you do not already have health insurance. Four things impact eligibility: marriage status, student status of children 18 to 23, caregiver status, and eligibility for Medicare or TRICARE. There's a related program for CHAMP VA caregivers. Other health insurance, commonly referred to as OHI, refers to coverage that an individual may have through another source, usually an employer or former employer. In this situation, individuals can retain their existing plan, and CHAMP VA will serve as a secondary payer. Reporting OHI is mandatory, although their health insurance must be disclosed. If the VA later discovers unreported OHI, it may review previous claims. What is the impact of Medicare on CHAMP VA? CHAMP VA provides coverage for eligible family members and survivors of qualifying sponsors. Individuals under age 65 will be covered by CHAMP VA. When beneficiaries are enrolled in Medicare, CHAMP VA becomes a secondary payer. In these cases, Medicare or Medicare Advantage pays first, followed by CHAMP VA, which covers a fixed deductible of $50 per person and $100 per year, after which CHAMP VA then pays 75% of the cost up to a maximum of $3,000 per year. To remain eligible for CHAMP VA, beneficiaries who qualify for Medicare Part A, which is hospitalizations, must also be enrolled in Part B, which is outpatient care. The standard premium for Part B is currently $185 per month for most individuals, although this amount can vary based on individual circumstances. There is usually no cost for Part A. Please note that enrollment in Parts A and B is required for continued CHAMPVA eligibility. Are children covered under CHAMPVA? Generally, a child becomes ineligible for CHAMPVA coverage upon reaching age 18 unless enrolled in an accredited educational institution. If a child marries or no longer resides in the household before turning 18, eligibility ends on the date of that event. Exceptions exist for helpless children who are permanently incapable of self-support. The question usually comes, should I sign up for Medicare and CHAMPVA, stay with an employer's plan, or sign up for a Medicare Advantage or Medicare Supplement plan with a commercial insurer? These are complicated questions, so my suggestion would be to get with a good VSO that knows the different plans. They would at least know where to get the answers on which one might be a better fit for you and your situation.
Let's talk about long-term care benefits. There's a cheery subject. There are a lot of misconceptions about long-term care and VA benefits. Before we start talking about long-term care, we better define what it is. Put succinctly, long-term care is care required for individuals with debilitating chronic illnesses. The operant term is chronic illnesses, and I'll put an asterisk in here that it's assumed that if you need long-term care, it is going to be for more than 12 months. Now, many people think of long-term care as nursing home care only, and it isn't. Long-term care is a continuum of care that runs from the most independent person to the most dependent person, starting with home health care, care provided at home, community services like adult daycare, assisted living or alternate living facility. In Indiana, it's called assisted living. In other states, it's called alternate living facilities. And progressing all the way to the most dependent service, which is the nursing home, normally bedridden. Now, most people kind of wish this away, but let's see what your chances of needing long-term care are. Most of you have car insurance. This is your odds of having a car accident. The way some of you drive, the odds are probably a little bit higher. What about having a residential fire? You all have homeowners insurance. This is your chance of having a residential fire. Most of you have some form of health insurance. These are your odds of being admitted to a critical care unit. Now, back in my younger days when I was an ambulance jockey in Louisiana, they called it intensive care. Everybody was calling it expensive care, so they changed the name to critical care because it was harder to make fun of. But these are your odds of going into critical care. These are your chances of needing long-term care. Literally 70% of Americans who reach age 65 will need some form of long-term care. Well, if you're going to need it, how much does it cost? This is a chart from 2023, Genworth Cost of Care Study. I haven't gotten the study for 2024 in yet, but take a look at the cost. Home health aides nationally cost about $6,292 a month. In Indianapolis, it's a little bit higher. Adult daycare nationally is about $2,000 a month. Indianapolis, it's about 3 times that number, and I'll explain why that is. Assisted living in Indianapolis a little bit less than nationally, and nursing home in Indiana is slightly more than national. The reason Indianapolis adult daycare costs so much more is there just isn't any. There aren't enough out there, and when I talk to providers, nobody wants to start them because of insurance issues. So you can see that long-term care is somewhat costly. So how do we pay for it? Many of you think Medicare will pay for long-term care. Medicare does not. It pays for skilled care for acute conditions. Acute conditions aren't called acute because they're acute. It's because they're short-term and you get better. Medicare does not cover long-term care. Who said that? the U.S. Department of Health and Human Services. Here's a copy from the page 4 of my wife's Social Security statement for a few years ago. These statements used to include on page 4 a paragraph that says, I quote right here, Medicare does not pay for long-term care, so you may want to consider options for private insurance. Your new Medicare statements that are available online don't include that warning. The older statements used to tell you when Social Security was going to run out of money. They would tell you when Medicare was going to run out of money, and they included this warning about long-term care. New statements don't do that. It's kind of like a song from the musical The Wiz. Don't bring me no bad news. The Social Security Administration doesn't want to bring you no bad news, but the fact is Medicare does not pay for long-term care, so you may want to consider private insurance. And what I often tell people, long-term care planning may or may not involve insurance, but it always involves planning. As we said, Medicare covers acute illnesses. These are what acute illnesses are. They're immediate, they're short term, you get better. Care is typically provided in a hospital or a skilled care facility. Chronic illnesses are progressive, meaning they get worse. They're long term, they are non rehabilitative, and care is provided at home, community, alternate living facilities, or nursing facilities. Chronic health costs are typically not paid for by Medicare. We'll talk about what Medicare pays for. Medicare pays for generally the transition from acute to chronic. This is what Medicare pays for. Acute condition may start at home, maybe a broken hip, stroke, heart attack, any of a variety of illnesses or injuries. The patient then goes to the hospital under Medicare. Once they arrive at the hospital is paid by Medicare based on what are called diagnostic related groups. There's another cheery term, they're called DIRGs. Diagnostic related groups. That means when the patient checks into the hospital gets paid for a broken hip, a stroke, a heart attack, a whatever. That means the hospital has made as much money off of that patient as they're going to the day they check in. So the hospitals try to stabilize them and then move into skilled care. In the industry, we call that getting out quicker and sicker. A skilled care facility is a facility that looks just like a hospital, smells like a hospital. There's just not a doctor there 24 hours a day. Some nursing homes have their own skilled care facility. Many nursing homes are called their hospital wing. Rehab hospitals are typically skilled care centers, but they meet a Medicare criteria of being a skilled care facility. So who pays for that? Medicare will pay for some of it if 3 criteria are met. The first criteria you must be very familiar with, and your family may have to stand up for you, or the patient's family may have to stand up for them. The patient has to have had a 3 overnight stay in a hospital for treatment. Emphasize treatment. What has happened recently, hospitals are starting to admit people for observation. Why? They have a financial incentive to do so. The Medicare, if a patient is treated and then leaves the hospital and has a relapse and goes back to the hospital within 30 days, Medicare can claw back some of the money they paid the hospital for treatment because the treatment didn't work. So a lot of times hospitals are now putting people in the hospital and saying they're for observation. The patient or their family or their personal representative need to get in the hospital space and say, he had a heart attack. What are you observing? I want him here for treatment. Because if it is listed for observation, it will not count toward the 3 overnights for treatment for Medicare purposes. So you have to have 3 overnights for treatment. They must be in skilled care. Medicare pays for no other level of care, and they have to be getting better. Medicare has certain criteria for that. It may be as little as they go down to rehab. But if all 3 criteria are met, Medicare pays for the 1st through the 20th day 100%, just like they paid for the hospital based on diagnostic related groups. The 21st through the 100th day, Medicare will still pay, but there is a $209.50 per day copay the patient is responsible for. Now, if the patient has a Medicare supplement level E or higher, that will take care of the copay. If they had a Medicare Advantage plan, you may have to look at that Medicare Advantage plans because there's a lot of leeway on what Medicare Advantage plans can pay for. So review the plan. After the 101st day, Medicare does not care how much better they're getting and how much skilled care they're getting or how many days they spent in the hospital. They are now chronic and Medicare quits paying. It's all on the patient and their family at that point. So you might take an inference that Medicare will pay for the first 100 days. That would be a bad inference because Medicare only pays on average for less than 30 days. Why is that? Because something happens in the first 30 days to make the patient not qualify. Take a look at this chart right here. Only half of 1% of care in nursing homes is in skilled care. So the patient may go to a different level of care. Or what is more commonly, they will go home. If they go home, there's a whole new set of rules. When they go home, there's two levels of care we talk about. One is professional care and one is personal care. Professional care involves therapy from a skilled therapist, like a physical therapist, a language therapist. Personal care involves assistance with activities of daily living. Medicare will pay for professional care if it's making the patient better. For example, let's say somebody has a stroke. They lose the use of both limbs on one side of their body, never going to regain the use of those limbs. They also lost their language, but will regain their language with language therapy. If the family brings in a physical therapist or an occupational therapist or a massage therapist to manipulate their limbs, Medicare will not pay for that because that's not recuperative, that's custodial. If the family brings in a language therapist to help them regain their language, Medicare will pay for that because that is recuperative. They are eventually going to regain their language. Personal care is the bulk of the care that is given at home. And that involves assistance with activities of daily living, eating, bathing, dressing, toileting, continence, that sort of thing. If the patient needs help with that, Medicare will not pay for that at all. They don't pay for personal care. It's all on the family to take care of that or to pay somebody else to do it. And there are a lot of people out there providing personal care to disabled family members. A most recent study found that the value of families providing care, or what we call informal care, to disabled elderly adults approaches the value of the entire Medicare budget. So there are a lot of people going on doing that out there. So how does the VA fit into this? I know you didn't log on to this presentation to find out about Medicare, but we did want you to be familiar with it so you can see how the VA fits in. How many of you have made this statement or heard this statement? I'm a veteran, the VA will pay for my care. That's not necessarily true. VA is a lot like Medicare. One set of rules for health care, another set of rules for long-term care. And their health program benefits are allocated for those with severe service-related illnesses under a priority group system. For custodial care, which is long-term care, that care is generally reserved for those with injuries that require it. About 25 years ago, the federal government contracted with LTC Partners to offer long-term care insurance to all federal employees, military, retired civil servants. It was a group program. It didn't do all that well, but the message was clear. The federal government is not going to pay for your long-term care. You could consider the federal long-term care insurance program to be similar to the warning the veterans admitted or the on the back of a social security statement saying Medicare will not pay for long-term care.
Oh, hold on.
Now, this, according to the VA, is what they provide for long-term care services. As I say, what they say. What they say and do may be two different things depending on your area. They say they provide 24/7 nursing and medical care, and they do that, but it's for a select group, and we'll explain what that is. They provide physical therapy, help with daily tasks like bathing, dressing, making meals, and taking medicine. Again, that is for a select group, and we'll talk about who gets that and how to get it. Comfort care and help with managing pain, and support for caregivers who may need skilled help or a break so they can travel or run errands. Again, this is for select groups. It's not going to be available everywhere. And by the way, this all came off the VA website. VA nursing home options. That's the first thing we'll cover because that's been going on for a while and it's most direct. The VA will pay for nursing homes for veterans with a 100% service-connected disability or at least 70% service-connected disability and who are homebound. Again, the federal long-term care insurance program is available for those who partook of it when it was available, but it didn't do well, and so they quit taking applications a couple of years ago, and they aren't going to start taking applications again until 2027. Now, getting back to what nursing home options are, when we say the VA will pay for nursing homes for these select group of veterans, it doesn't mean you can go to any nursing home you want to. It means the veteran must go to a nursing home that is contracted by the VA, and there aren't that many. I work with a couple right now whose father is in a nursing home slowly dying of Agent Orange poisoning, and they had to work real hard to find a nursing home within an hour of their home in West Indianapolis. There's also the Indiana Veterans Home. The Indiana Veterans Home is, in fact, a contracted VA nursing home. However, veterans don't go there for free unless they meet a certain criteria. Indiana Veterans Home is free to those veterans who are 70% service-connected disabled and homebound or 100% service-connected disabled. But if they don't meet those criteria, it is private pay until the veteran goes on Medicaid. The aid and attendance benefit is one of the most misunderstood benefits out there because there's so much confusing information about it. It is a benefit that is available to wartime veteran spouses and widows, and the intent is to keep them off the street. There are strict limits on the net worth. They may have no more than $159,240 in assets as of December 1st, 2024. The number changes every year. Now, primary residence doesn't count as an asset, and one car doesn't count as an asset. It's kind of like similar requirements as for Medicaid. Also, countable income is deducted from the eligible benefits, so you just may assume that the benefits are limited by the income as well. Also, when it comes to the net worth, the veteran just can't give away the money to get down to 159,240. There is a 3-year look back period for gifting money away. Very similar to the old rules for Medicaid before the Deficit Reduction Act increased the look back period to 5 years. And what you'll find a lot with the rules for veterans benefits, they follow along a lot with Medicaid rules. Countable income for VA purposes is pretty much anything that would count for Medicaid purposes. I used to say count for IRS, but there's some income that would count for IRS that won't count for VA purposes. But pretty much anything that would count for Medicaid is going to count as income for VA purposes. Now you can get some of that income down by deducting. There are certain expenses that are deductible from income for VA purposes. One is educational expenses. So if you're trying to qualify for VA benefits, you might want to get your PhD. The other is more likely to come into play, which is unreimbursed medical expenses. Unreimbursed medical expenses can be deducted from your income as you're trying to qualify for aid and attendance benefits. Now, it's not like the IRS where you have to have 7.5% of your adjusted gross income before you start seeing any benefit. It's every unreimbursed medical expense you have is deducted from your countable income when computing your VA benefits. To be eligible, the veteran has to have had at least 90 days of active duty with at least 1 day during a period of war. And the VA has a list of those dates, and you can check with any VA veteran service officer to fill you in on that. They have to have a discharge other than dishonorable. The surviving spouse, if it is a surviving spouse that's applying for the aid and attendance benefit, must have been married to the veteran at the time of his passing and has not remarried. And the person requesting aid and attendance must require assistance of another person to perform activities of daily living. They must also meet the income and countable asset criteria established by the VA, and we'll go into that in further detail later. and they must be 65 years old or older and be totally disabled. And again, this is not for anybody that just wants some additional income. They need to be elderly, partially disabled veterans or spouses who are sitting on the poverty line. This is straight off the website to tell you, am I eligible for aid and attendance house or housebound benefits? Because there are housebound benefits that are similar to aid and attendance, but slightly different. Similar rules though. This is how you tell if you're eligible. You may be eligible if you get a VA pension and it needs to meet at least one of these requirements. You need another person to help you perform your activities of daily living. You have to stay in bed or spend a large portion of your day in bed because of illness. That doesn't mean you like to stay in bed and watch TV. It means you stay in bed because you can't get out of bed. You are a patient in a nursing home due to loss of mental or physical abilities, or your eyesight is limited. I won't go through all the details here, but basically you're legally blind. Am I eligible for VA aid and attendance household benefits as a veteran or survivor? Housebound benefits eligibility, you must be eligible for this benefit. If you might be eligible for this benefit if you get a VA pension and you spend most of your time in your home because of a permanent disability. That means a disability that won't go away. You don't get it for breaking your ankle or throwing your knee out for a few days. It must be a permanent disability. And no, you can't get aid and attendance and housebound benefits at the same time. Maximum monthly benefit. Now, there's a whole bunch of different criteria. If you go to the VA and get to the website, you may see there's probably 24 criteria. I'm going to show you 3. Now, you'll probably have to go to a veteran service officer to find out which criteria you fall into because they change the VA website all the time. And the last time I went there, these were the only criteria they had up, but there are literally at least 24 of them. A surviving spouse of a veteran, their maximum monthly benefit is $1,515. A veteran with no spouse or dependent who needs the assistance can get $2,358. 2 married veterans where one spouse requires care can get $2,795 a month. The aid and attendance benefit is limited by income and maximum annual pension rate. That's our new acronym, MAPPER, because you can't have a federal program without an acronym. So remember MAPPER. The MAPPER is the maximum annual pension rate that you qualify for. And the pension the veteran will receive equals the MAPPER minus the countable income. Here's an example. And again, this is straight off the VA website. Qualified veteran with a dependent non-veteran spouse and no children, and the veteran qualifies for aid and attendance benefit. The couple has a combined annual income of $10,000. The MAPPER amount is $33,548. The yearly income is $10,000. They deduct the yearly income from the MAPPER, and the aid and attendance benefit becomes $23,548 per year, or $1,962 per month, because it is paid in 12 equal installments. Now, veterans' incomes are added to their net worth when determining eligibility. Let's say, for example, and this is, by the way, this is straight off the VA website. Veteran has a net worth of $145,000 and an annual income of $14,000. The VA makes the computation $145,000 plus the annual income of $14,000 come out with $159,000. That total is less than the net worth limit of $149,240. So the veteran would receive veterans pension benefits. That said, if the income had been $15,000 or if the net worth had been $146,000, it would have totaled out to $160,000. And so the veteran would not have qualified. So they have to figure out some way to get it down to that limit. It's okay if they're close to that limit to figure out some way. They can't give the money away, but they could buy something or put the money someplace that would make it non-countable. I will warn you about some unscrupulous people who want assisted living facilities and nursing homes to try to find veterans and veteran spouses who are there, and will go and try to convince them to get rid of significant assets so they can qualify for aid and attendance benefit. When my mother checked into an assisted living facility, she had about $750,000, and we had somebody go to my brother and tell him, well, she should take $650,000, put it into an income annuity. Of course, he didn't mention that he would get a 10% commission off of it because it would be a totally unsuitable annuity that would pay bigger, more in commission than outgo, so that she could get her assets down to about, at that time was $100,000, and receive about a $1,500 benefit per month. And my brother said, that sounds like a really good deal. And I said, it is for the agent because he's going to make a lot of money and go buy a new car. Won't be such a great idea for mom because what if she needs nursing home? How's she going to pay for that? And by the way, she did need that, and she did need the money, but she didn't live very long. So my brother found out it was a better idea to leave that alone because then he got an inheritance. It's okay if they're close to the limit. You help them do that. I have done that with Medicaid patients. I have helped people get their assets down to the Medicaid level, but only if they were very close and only after I have exhausted every other avenue to keep them off of Medicaid. So just beware of the person who skulks around the nursing home telling you if you give you all their money, you will qualify for some paltry benefit. VA long-term care community services. This is a new thing. And if we try to get you enrolled in that, or you try to get enrolled in that, trust me, there will be some growing pains. But this is the eligibility for VA long-term care community services. The veteran must be enrolled in VA healthcare. They must have a clinical need. And this is a big caveat. The service must be available in the area because it's not going to be available in all areas. The VA long-term care community services include geriatric evaluation, adult daycare. Remember, I said it has to be available in your area. In Indiana, adult daycare services are few and far between. Homemaker and home health aid under certain circumstances, and we'll cover that. Respite care. What respite care is, if you have a caregiver, the caregiver is taking care of you. The caregiver may need to take a break, so they can bring somebody in to take care of you while your caregiver takes a break. But you would have to be on a home health care benefit, and we'll talk about how to get that. Skilled home health care, and this is an important factor. If the care you are getting, the veteran is getting, has a room and board charge, the VA will not pay for that room and board charge. And here's the other big caveat. On everything else we have on this list, co-pays may be required. What's new? Home-based primary care. We're going to talk about that. Medical foster homes. This is something new. Remember children's foster homes? You foster a child. They do it with older adults now. A family will decide to take in an older person and take care of them, provide them home health care. They are rare. The VA has them listed on their website. There are almost none in Indiana. I think there are 2 in Muncie, and that's about it. But remember where we said VA won't pay for a room and board? In these medical foster homes, there is a charge for room and board. The program of comprehensive assistance for family caregivers. This is a great option that is just coming online. We'll talk about that in a minute. The Elizabeth Dole Act. This is not specifically a VA benefit. It's something you should be aware of. The Elizabeth Dole Act directed the Social Security Administration and Medicare to come up with more benefits to help people staying at home and who needing assistance at home. That is also shaking out. But just be aware that that just got passed about 6 months ago. And always remember, co-pays may be required. Home-based primary care services. Remember the old joke, the doctor says, I don't make house calls. When I was a little kid, some of us were little kids, doctors made house calls. They're actually doing this now. If you get home-based primary care services, the doctor will come to the veteran at their home. It's better for the veteran. It may be even cost less for the hospital, but they come to the veteran and visit their home. They provide care management services to make sure they get the care they need. There may be social work because a social worker may need to help them get in contact with resources in the community. They may provide rehab, psychology, nutrition, and pharmacy. But remember, it's all based on the services that may be available in your area. And again, the continuing caveat, co-pays may be required. Comprehensive assistance for family caregivers. This is where we talked about so many caregivers taking care of so many people. The VA is going to provide, or going to start trying to provide benefits for family members who try to take care of disabled veterans. This is the eligibility requirement for the veteran. Here we go with that 70% or higher again. Veterans will only qualify for comprehensive assistance for family caregivers if they have a disability rating of 70% or higher. The veteran was discharged from the U.S. military or has a date of medical discharge, and the veteran needs at least 6 months of continuous in-person personal care services. Means they really got to be down. It has to be guaranteed that they're going to need to care for at least 6 months. The veteran must be enrolled in VA healthcare. And this is really important. Consult your service officer for eligibility and availability. Service officers are critical for this. You're not going to find the benefits on your own. The service officers are having a hard time figuring out because it's so new. Now, who gets to be the caregiver? The caregiver must be at least 18 years old, and at least one of these things must be true. They're the spouse, son, daughter, parent, step family member, or extended family member of the veteran, or they live full-time with a veteran, and they're willing to live full-time with a veteran if the VA designates them as a family caregiver. How many caregivers can you get? 1 primary and 2 secondary. And it's really important that they have 1 primary and 2 secondaries because statistically, if one spouse tries to be the caregiver of the other, the caregiving spouse will die before the care receiving spouse. So the primary caregiver is going to have some backups to give them a break so that they don't die before the veteran does. This is what the eligible primary and secondary family caregivers can receive. Caregiver education and training so they can properly care for the veteran. Mental health counseling. Why do they need that? Go figure. Travel, lodging, and financial assistance with traveling with the veteran to receive care if they have to go to a distant location. Eligible family caregivers can also receive a monthly stipend for caring for the veteran. And here comes CHAMPVA again, access to CHAMPVA if they don't qualify for another type of insurance. To find out more about the family assistance comprehensive assistance for family caregivers, go to this website, www.caregiver.va.gov. This is what the website looks like. It has a lot of information on it, but I can tell you the VA website tends to be a mile wide and an inch deep. It will give you a lot of general information and give you some good questions to ask, but mostly what it will allow you to do is arm yourself to go meet with a veteran service officer and ask him or her the questions. I just leave that up here for a minute so you can all write that down. This is the bottom line. VA benefits are designed to provide some long-term care support services for severely disabled veterans and provide some assistance to wartime veterans and their widows. They are not a substitute for responsible long-term care and retirement planning. At VVA 295, we have a book you can check out. Now, there are lots of books on this. This is the one we like. I personally like it because it was written by a friend of mine, by Carol Golden, who's the executive director for the Limited and Extended Care Planning Center. It's a think tank for long-term care. Talks all about how to do a long-term care plan. We had one of our chapter members came to me one time and said, "Can you help me make a plan for my mother? She's in her 90s, still lives on her own in Ohio." And I said, "Sure. Read this book and we'll talk about it." This was just before Christmas. We'll get together after the first of the year. After the first of the year, I came back and I said, "Do we need to get together to talk about your mother?" He said, "No, that book answered all my questions." So it shows that I'm about as valuable as a book. But it's available for checkout here at VVA 295, and it's also available on Amazon. And it's one of many books that are available. What it will tell you to do is form a CPT. That's not get a captain. It means get a care planning team. You've all been on teams in the service, or you've been on football teams, or you've at least seen a team someplace. Everybody has a job to do. If you have a care planning team, everybody in your family or everybody that's going to be involved in your care has a job to do. Who's going to call the doctor? Who's going to call the VA? If the worst comes to worst, who's going to call the funeral director, etc. Make sure it's all laid out and everybody knows what they're supposed to do. So when something happens, they don't run around saying, oh, what do we do now? You'll need to have some professionals on call, a gerontologist or a geriatric physician, somebody who specializes in the illnesses of the aging. Why? Because a lot of times older people get over medicated. You have several different doctors giving different kinds of medications, and yet the pharmacists are supposed to share the information, but sometimes it doesn't get across. So there may be some negative interactions, and a gerontologist or a geriatric physician can figure that out. An elder law attorney. Now, in Indiana, there is no standard for elder law attorneys. If you are a licensed attorney and you hang out a sign that says, I'm an elder law attorney, um, that's good enough. Unfortunately, many elder law attorneys in Indiana are actually just Medicaid attorneys, which is fine if your long-term goal is to become an indigent ward of the state, because that's what Medicaid is. I work with a number of elder law attorneys, and I always interview them before I recommend them to my clients. If anybody talks about just they can qualify anybody for Medicaid, I don't work with them. I work with people, with attorneys who understand the system and want to help their clients get through it using Medicaid as a last resort, not as a first option. What you should really look for is a CELA, a certified elder law attorney. Think of that as a CFP for law. These are people that understand elder law, also the medical aspects of aging, so they can help their patients navigate the system in an effective way. Also, see if they're a member of NALA, National Association of Elder Law Attorneys. That shows their commitment to their profession, that they're going to advance profession, just like a CFP would be a member of a CFP organization. A CPA would be a member of the AICPA. This is a good website to go to, the Indiana Long-Term Care Insurance Program website. Not that you're going to buy insurance, as I said before. Long-term care planning may or may not involve insurance, but it always involves planning. It's just there's lots of information on the Indiana Long-Term Care Insurance Program about long-term care, Medicaid, and aging that is extremely valuable when making your plans. VA Long-Term Care Supports and Services website is, as you see here, they have their own website. And here's what it looks like. Got also all those little squares there are videos you can click on. Again, this is another one that's about a mile wide and an inch deep. Got a lot of information, not a lot of information on how to receive the benefits, but it will equip you to understand what may be available, so you can go to your service officer to see if you can get these benefits, if they're available in your area. This is where the service officer becomes really important, because if you go ask him the questions, the service officer can go to the VA and try to represent the interests of the veteran, the veteran's family, to see if you can get these benefits. Remember, all benefits may not be available in your area. If you need to ask me questions, this is how to get a hold of me. Things to do when planning for your future if you're a veteran. Gather your documents. Have a will. If you die without a will in Indiana, you're intestate. That means it goes to probate and the lawyers find out about it. And what usually happens is the lawyers end up with all the money. And what will happen then the judge gets to decide where all your assets go, and it may not go where you wanted it to go. Two powers of attorney, medical and financial. One is a medical power of attorney, what to do um, if you can't make decisions for yourself. Who's going to make financial decisions? Who's going to pay your bills if you can't pay the bills? And the person you give the power of attorney to should be someone who makes the same decision you would. For example, in my case, my youngest son is my power of attorney and my wife's power of attorney for both medical and financial, because he's the only one who would not be so distraught emotionally at the time that he would be able to make legitimate decisions. And my older son and my daughter have both agreed with that. DD 214, and have several copies of it. That discharge paper is going to get you your benefits. You're probably going to have to give it to the funeral director to make sure you get the flag and whatever other benefits you have. You may have to send it off someplace to get the presidential certificate. Have multiple copies, because if your heirs take one copy and give it to somebody and then they find out they need another copy, they may not be able to get that first copy back. I talked to a veteran one time. He said, well, I've already said I've got a DD 214 in my file, and my kids can make as many copies of it as they want. And I said, hey, do you think they'll remember to make copies? Wouldn't it be better for you to make several copies now, so in case they get excited and go to the funeral director and he loses it, they still have more? Pick a service officer, particularly if you know the time is near and it may be a service-connected death. Know who your spouse is going to go to get their benefits. Put all your critical information in one place and make sure people know where it is. Have a financial plan. Plan your care. And for those of us who are computer literate, most of us have multiple passwords. Save all of your passwords and put them someplace where somebody who needs to get them can get to them. These are the contacts here at VVA 295 here to answer your questions. I hope you found this presentation informative. Again, if you have any ideas as to how we can improve it, please let us know.